Yes.
This is the heart. So let's start with the right atrium. That is this. This little flap here is the auricle. We'll open it up. This bumpy part is the pectinate muscle. 32 here is the sinoatrial node. 36 is the atrioventricular node. And this is the entrance of the superior vena cava. 55. You see the white. That is the fossa ovalis, which during fetal stage used to be the foramen ovale. And we'll go in here. You see 33. That's the entrance to the inferior vena cava. And this area is the entrance to the coronary sinus. This is the valve right here. This is the superior vena cava, inferior vena cava. Superior vena cava, it drains from the right and left brachiocephalic
Do you have a lab manual?
veins.
In my backpack.
We'll move on to the right ventricle. Before that, this is the coronary sulcus, number 3. And we'll move in here. So the blood, it goes into the right ventricle through the tricuspid valve. Tricuspid valve is held in place by the chordae tendineae, number 40, which is pulled along by papillary muscles. This branching of muscles here is the trabeculae carnae. And this fiber here is called the bundle of His. And the continuation of it down here is the Purkinje fibers. So then blood gets shunted through this semilunar valve. It's called the pulmonary valve. It goes through the pulmonary trunk, which gives rise to the right and left pulmonary arteries. And then arteries goes through the lungs, and then gas diffuse, and then comes back to the heart through the pulmonary veins here. And then blood enters into the left atrium, which is right here. From the right atrium, it goes through the tricuspid or mitral valve into the left ventricle. Bicuspid. And then you can see more papillary muscles. This is the chordae tendineae. This is the, if you see in here, is the interventricular septum. And then blood now has to go through the aorta. You see in here, this is another semilunar valve, the aortic valve. Goes through the ascending aortic arch. First branch off of it is the brachiocephalic. Second one is the common carotid, left common carotid. 15 is the left subclavian aortic arch. Speaking of things, this is the ligamentum arteriosum. And let's do some of the coronary stuff. This is the right coronary artery. This is the left coronary artery. Speaking of, in between here is the anterior interventricular sulcus. And then directly posterior to that is the posterior interventricular sulcus. And then we'll do more blood vessels. This is the circumflex artery. 28 is the great cardiac vein. And 27 is the coronary sinus. If you remember coronary sinus valve here, that's where it goes out to. This big fat vein here.
Trachea.
Oh yeah. You look here.
Bronchus.
That's the trachea. And that will be the right primary bronchi. And then the left primary bronchi.
The esophagus.
I don't know if you have esophagus. In case you want to know.
That's it.
Okay, that's it.